everyone. Welcome to our webinar. We're going to be starting in just 1 minute. Welcome, welcome. Thank you so much for joining the Equal Pay Today and IWPR webinar. We will be starting in just 1 minute as people are getting into the webinar Zoom room. Great. All right, we're going to go ahead and get started. So welcome, everyone. Thank you for being here, for joining our webinar, The Gender Wage Gap and Occupational Segregation, Tackling the Undervaluation of Human Services and Care Work. I'm Deborah Vagans, the National Campaign Director for Equal Rights Advocates and Director of Equal Pay Today. You can do the next slide. Today's webinar is co-hosted by Equal Pay Today and IWPR. And first, let me tell you a little bit about Equal Pay Today. The campaign is a national coalition bringing together local, state, and national groups and supporters across the country to close race and gender wage gaps, accelerate fair pay progress state by state, and drive federal momentum. Equal Pay Today prioritizes workers and communities most impacted by pay inequity and wage injustice. Galvanizing millions in communities across the country, Equal Pay Today leads policy reform, public education and awareness campaigns, and enforcement of fair pay laws. The campaign has multiple committees where people can get involved. Today's webinar has been developed by our Research, Litigation, and Enforcement Committee and is the latest of IWPR's and Equal Pay Today's series of webinars, which have looked at occupational segregation and other key drivers of the wage gap. If your organization is not a member but would be interested in learning more, I'll drop my email in the chat after this introduction, and you should feel free to reach out. Now, a little bit about this webinar. As we continue to fight for equal pay for equal work, we also know that there are other factors and forms of discrimination in employment that impact women's pay throughout their career, impacting their long-term economic security. In Equal Pay Today's pursuit of wage justice, we work to address all key contributors to the pay gap. In fact, the wage gap numbers that we all know so well are driven in large part by the fact that the fields that are held predominantly by women are usually lower paid and undervalued. It is this occupational segregation of women into underpaid work that makes the wage gaps so persistent and drives the needs for reforms that lift wages and address equal pay for comparable work as well. You can also check out the newly launched policy agenda of the Equal Pay Today campaign that I'll drop into the chat, which addresses this and other issues. So I'm thrilled that we'll be hearing from all the experts on today's call about this important topic and what we can all be doing together to affect change. Next slide. But before I turn it over, just a little housekeeping. Please put your questions for the panelists in the Q&A by clicking the Q&A button at the bottom of your screen. And also please use the chat to introduce yourself and to chat with fellow attendees. We'd love to know where you are and what organizations you're representing. We encourage you to use the chat to connect during this webinar and to join with us in community. This webinar will be recorded and will be made available after the event. So now I want to hand it over to Ariane Hegevish, who is a senior research fellow at the Institute for Women's Policy Research and co-chair of the Equal Pay Today Research and Litigation and Enforcement Committee. She's moderating this webinar and a wonderful friend. So let me turn it to Ariane, and we'll turn it to the next slide as well. Thank you.
Not the next slide. Can you go back? Thank you very much. Thank you, Deb, for the introduction. And as Deb says, I work at the Institute for Women's Policy Research. We are a think tank in Washington, D.C., and we are focused on women's economic equity and economic security. So equal pay is at the core of our concerns. This is about the third webinar which EPT and IWPR have organized jointly broadly around the theme of occupational segregation. And as Deb says, the fact that women and men often don't do the same work and that women's work is paid less at the same level of education or demand of skills was brought really to the fore during COVID-19 and has been a long established facet and challenge when pushing for equal pay. What this means is, of course, that an equal pay strategy that is mainly focused on equal pay for the same work is vital, but not sufficient to get rid of the wage gap. And this is why in many countries, though not the United States, equal pay statutes go beyond equal pay for equal work to include equal pay for equal value or work of equivalent or comparable value or worth. And indeed, if you look back a little bit, the period in the United States where we have made most progress in terms of closing the gender wage gap, the 1980s to the early 90s, was also the period when there was a very heightened awareness and activism around the need to tackle the undervaluation of the type of work that women were going to do. And particularly many states, but also some private sector companies reviewed their job evaluations and internal methods of setting pay relativities. And as a result of that, there was a significant increase in terms of women's wages and a narrowing of the wage gap. However, all those efforts went to sleep in the late 80s when legal cases made clear that the Equal Pay Act would be interpreted much more narrowly, and a bunch of other things happened too. So where are we now? The policy momentum we are in terms of women's economic security at the moment, arguably is all about occupational segregation. On the one hand, we have the big public investments in infrastructure, a focus on creating good jobs in sectors that employ very few women, with a commitment to getting more women into those sectors. But then on the other hand, of course, there's a high level of awareness of the essential nature of care work, although unfortunately not the same level of resourcing and funding that is there on the hard infrastructure. And one of the results is that there is high level of vacancies as workers are voting with their feet to leave the sectors. And if not a solution, at least the crisis of care work is very evident and in policy. So the question for me and behind this webinar to some extent is whether we can use this moment and all this infrastructure money to tackle the underpayment of care work, and whether comparable worth or comparable value as a frame can contribute to that. Now, to the webinar, we have three fantastic speakers. We're going to start with a contribution from Australia, from Professor Meg Smith from the School of Business at Western Sydney University. Thank you, Meg, for being up so very early in the morning to accommodate us. And Meg will talk about the sector-based strategy that was used in Australia or was successful in Australia to leading to a substantial pay increase for workers in part of the elder care sector. Australia is of course very different from the US, but I think it's partly for inspiration, partly there's some concept that I find really intriguing, such as the Fair Wages Commission that played a role in that, and maybe that's a model for some states. That is Meg, and because it's such a specific topic, we're going to allow a few clarifying questions afterwards if you have any, but there will be references at the end and you can also leave that for later. And then we are going to bring the presentations back to the United States with two great presentations that both focus on human services work. And the authors of two studies that both were published at the beginning of the year and were done completely unbeknownst to each other, showing, I guess, that this issue is in the air of high importance. One from Seattle and the other study from New York. And so we will start with Jennie Romich, who led the Seattle Equal Pay or Pay Equity Study, and IWPR was very pleased to have been able to be part of that study. And Jennie will talk about the methodology and the findings, as well as the messages developed for policymakers. The overall data on underpayment is pretty similar in both cases. So then James Parrott from the New School will focus more on the policies that led to the underpayment of human services workers. And once those great presentations are over, there will be time for comments and questions. And now, without further ado, I would like to have the next slide and the next slide and introduce Meg Smith again and give the word to her. Thank you.
Thank you very much, Ariane, and a warm thank you to IWPR and Equal Pay today for the opportunity to speak at the webinar this morning. Next slide, please. In joining you today, I'm acknowledging that I'm joining you from unceded Barramadigal lands of the Darug Nation. Next slide, thank you. What I'd like to share with the webinar today is a case in aged care in Australia that resulted in a 15% wage increase, but position this case against reasonable struggles in Australia to prosecute the objective of equal remuneration for work of equal or comparable value. And so this outcome stands in some contrast to the recent regulatory challenges that have faced equal pay advocates in Australia. Something of a deep dive into the case in the 10 minutes to look at the analysis and evidence that was instrumental to the finding, and if there's time, pose the question of whether the aged care decision poses a new way forward for gender pay equity advocacy in Australia. Next slide, thank you. Prior to commencing, I just thought I would speak a little bit around a particular feature of Australian labour law. And it's a term that we use, which are awards, which are sector-wide arrangements that prescribe minimum wages and conditions for workers and employers that fall within the scope of that award. They are determined by an industrial tribunal, as Ariane has noted, that's currently called the Fair Work Commission in Australia. So there are 154 awards in Australia, federal awards, and the majority of workers in Australia fall within the federal jurisdiction, labour law jurisdiction, as opposed to a state or provincial jurisdiction. There are 3 major awards that apply in aged care. The Aged Care Award applies to residential aged care. The SHADS Award, as we call it, Social Community Award, applies to those in home care, workers who work in home care. And we have a slightly anachronistic award, which is Occupational Award, which is a little unusual, which applies to the nurses who work in aged care in Australia. Now, of course, it's possible to have enterprise agreements that sit above the award, but there's a reasonably low level of enterprise bargaining in aged care in Australia. So the awards here set the minimum terms and conditions. Next slide, please. Another interesting feature in Australia is that there's not a single minimum rate. So we have an example of the aged care wage structure here in the Aged Care Award. And so each classification has a minimum rate. The rates, as noted here, are weekly rates in Australian dollars. And so we don't necessarily have just a single minimum rate of pay. There's multiple minimum rates, and for each classification in an award, that prescribes a minimum rate of pay below which workers cannot be paid. And this will become important as I delve into the intricacies of the aged care case. Next slide, please. It's worth noting that workers in aged care in Australia are low paid. So if we go initially on this graph, this is showing the wage rates in the Aged Care Award. On the right-hand side, we have two measures of 2/3 of median full-time earnings, both drawn from different surveys of the Australian Bureau of Statistics. The 2/3 measure is held in Australia, 2/3 of median full-time earnings is held to be a measure of what constitutes low pay for those in employment. There's not a single survey measure, and so two are utilised as reference points. And median full-time earnings represents a far lower measure than average weekly earnings in Australia. So you can see there that the majority of classifications in aged care, the minimum rate of pay fell below 2/3 of median full-time earnings. And this provided an avenue, in a sense, a great deal of focus in aged care. We had significant egress or workers leaving the industry because of the nature of pay in the sector. And the data here indicates both for those who are personal care workers. So, you know, there's about 365,000 workers in aged care in Australia. And of course, that's relative to a workforce of 14 million in Australia. Majority of those are personal care workers, and these are the sorts of workers that we see in this slide. A highly feminised industry, and so 83% of direct care workers identify as female, and it's also culturally and linguistically diverse industry as well. Next slide, please. And similarly, these are for nursing classifications using the classification as an enrolled nurse. We see there even that relative to nurses employed in other sectors, so primarily the hospital sector, have low rates of pay for the enrolled nurses, this obviously prior to the most recent decision. Next slide, please. So I'd like to position what was the outcome in this case against the significant challenges that occurred in Australian labour law in prosecuting the objective of equal pay for work of equal value. So, like many other jurisdictions, we moved from the prospect of equal pay for equal work, recognising Ariane's introduction. And that was reasonably sort of straightforward, but it was the prosecution of what how equal pay value was to be assessed, interpreted, and determined in an industrial tribunal that has proven to be difficult. We've had, various, I guess, waves of regulation that have attempted to address that, each with complication. And so the Industrial Tribunal in Australia rejected the concept of comparable worth, accepted the concept of comparable value. Comparable worth was viewed as being worth to the employer, as opposed to a measure of value with application across an industry. We've had strong legislative provisions, but in that case, applicants had to demonstrate discrimination in order to achieve equal pay. And more recently, we've had cases where the tribunal has argued that for equal remuneration order to be granted, applicants had to demonstrate the absence of equal or comparable value by reference to a male comparator. Now, in Australian equal pay circles, we don't think that the reference, because of the nature of occupational segregation, that to demonstrate the lack of fair valuation of wages by reference to a male comparator necessarily achieves the objective of ensuring that the value of the work is properly set. And this is where advocacy has tended to focus around the concept of undervaluation, demonstrating that the work is not properly valued and that there's been a series of factors that have contributed to that undervaluation of work. But in a long history that I'm sort of summarising here in about 90 seconds, applicants seeking what we would view as equal remuneration orders, which theoretically has the capacity to address not only minimum rates, but actual rates of pay, have been reasonably unsuccessful in the Australian jurisdiction. And so applicants have chosen a new path. I'll go to the next slide. In the aged care case, the applicants, which were trade unions, sought a 25% wage increase. And they did so not by way of the equal remuneration path or seeking equal remuneration orders. They did so simply on the basis of an application to lift the minimum rates in the relevant awards on the basis that the work was not properly valued. The work here, and I declare a self-interest, I provided expert witness evidence here, was to go to the process of undervaluation. And we address the barriers to proper work value assessment by industrial tribunals historically in their address in female-dominated industries and occupations, and the effect of those particular barriers and interpretation on the setting of minimum rates. Utilising the work of Jill Rubery from the UK, we utilise the term gender-based undervaluation. Doing so where by virtue of a range of overlapping practices, there's been a failure of the tribunal to recognise work value in assigned wages. We used that as our conceptual frame. We addressed simply the absence of work value assessments or incomplete or inadequate work value assessments. And we did so in the capacity that, like other jurisdictions, there's been a narrowing of opportunities in Australian industrial relations to address minimum rates as governments have favoured enterprise bargaining or more individual forms of bargaining. So sometimes it's not only been errors in work value assessments as we may see them, but it's been the absence of opportunity to undertake work value. Excuse me again. Inadequacies in the description and classification of work, which didn't fully recognise the skills exercised in the work, and of course, the effect of socially constructed understandings of gender. So our evidence went to the processes that had impact proper valuation of work. Next slide, thank you. A wonderful colleague, Anne Junior, then did work on the substance of undervaluation using a tool which we call the Spotlight Invisible Skills Job Analysis tool, using interviews, workbooks from workers in the industry to identify the work with a particular focus on skills that which were not evident in classification descriptions and had not been evident in the assessment of previous valuation of the work. So her work particularly focuses on skills that we might view as being invisible. And so she developed a framework where she coded skills as hidden, underdefined, underspecified, undercodified, and the lack of training or experiential learning being in any way recognised in the assessment of the work. The underspecified area may have sort of particular application where in the context of caring work, in that the skills were seen as soft or natural or misdescribed as innate and personal rather than skilled work. Next slide, please.
1 minute.
So we come to the decision here. And there was an acceptance here, I think the really sort of key thing that some of the take-home messages that the tribunal ruled that undervaluation occurs on the basis of occupational segregation, weaknesses in job valuation mechanisms, and the impact of social norms, gender stereotypes, and historical legacies. So this was a key decision. It took on the issue of the limited capacity to address valuation of the work and the tendency in the past to position the valuation of work against masculinized standards. Most particularly in Australia, the Metal Industry Award has formed a sort of a framework classification that against which other awards have tended to be positioned. So in terms of the processes of undervaluation, the decision recognised work that had been undertaken by a number of colleagues in Australia, which went to the weaknesses in work valuation mechanisms and indeed the absence of work valuation mechanisms. Next slide, thank you. Interestingly, and perhaps crucially, the tribunal ruled against the employer's characterisation of certain, as termed here, spotlight skills. So these were the invisible skills as personality traits or dispositions. Indeed, they viewed it as the application of skill in a workplace. So this was a critical outcome in the case. And indeed, just picking the direct quote at the end of the slide there, they noted that the mischaracterization of so-called soft skills, and this is sometimes how they're diminished, you know, the sense of soft skills in some way doesn't make its way to classification, descriptions of the work or job descriptions. And they were described in some employer submissions as the simple cognitive activity of adults. And the tribunal noted that they thought that such a characterization rested at the centre of the gender undervaluation of the work. So these were sort of critical outcomes. Next slide. Thank you. There was common ground, and in an era where these cases are always highly contested, there was common ground, I think, which was important around the growing size of the sector, the complex morbidities that workers in the industry have to address. So that was important, I think, to the outcome. But critically, the tribunal ruled that the current wage rates did not properly compensate employees for the value of the work that was performed. They noted a full increase of 15%, which actually starts from 1st of July, so very imminently, not phased in, applied in full, in a sense. Critically, the federal government in Australia has included within its budget $11.3 billion over 4 years to assist the funding of the wage increase. And there is indeed scope for further submissions in further iterations of the case to address whether any part of the applicant's case for a 25% wage increase, noting that a 15% wage increase was awarded, needs to be drawn out. Next slide. Ariane, I might come back. I've noted that I've taken my allotted time. I can come back to this slide in questions if that's agreeable. I don't want to take the time of others.
Thank you very much. And next slide, please. I think and next, yeah, that's great. So thank you very much, Meg. I think the questions that were there that of a technical nature in the chat were resolved. An award is like a legal sector agreement, which often unions have a role in, but it's legally enforced, like minimum wage across the sector. And it was a male comparator, not a mild comparator. But now I would and we're going to have time for discussion, including for the discussion of the role of unions and unionization right at the end after all of the presentations. And now I would like to introduce Jennie Romich, who is professor at the West Coast at the School of Social Work at the University of Washington, and also director of the West Coast Poverty Center. And over to you, Jennie.
Okay, next slide, please. Thank you, Ariane, and for organizing this event. And thank you all for attending. It was great to see some familiar names from Washington State in particular. I'm going to be talking, next slide, about a report that colleagues and I issued this past February. I'll put a link in the chat where you can find the full report. Next slide. This was work commissioned by the City of Seattle after an extended period of lobbying by the Seattle Human Services Coalition, which is a membership organization of local nonprofit human services providers. I should note, as this was publicly funded work, that we had excellent advice and oversight, but the conclusion and interpretation belonged to our team alone. Next slide. Part of why the city was interested in funding this work came out of things similar to what Meg was talking about, staffing shortages in the human services in Seattle. And although Human Services Coalition had been working on the issue of wage equity for a long time, once the low wages and other things happening in our metro area started to make it so that the city and county weren't able to contract out for some of their recognized public policy priorities that they would contract out with nonprofits for. That's when it became more of a public issue. Next slide, please. So the goals of our study were first to just estimate the gap between what was paid to human services workers and other workers in the region. We did that through a market analysis of quantitative data on market rates. And second, to establish some sense of equal value. And this goes to the comparable worth idea that Ariane's discussed up front, which is to say, how is this comparable? How is this equitable or inequitable when you look at the nature of the work? And we used a job evaluation skill. If we have time, I'd love to talk to Meg about how the methods we use are like or unlike their soft skills, hidden skills work. But first, let's talk about who the human services workers in the city of Seattle and in King County were. Next slide, please. Next. So human services workers work in nonprofit settings, in public settings, and in private sector. Our focus largely is in people working in nonprofits, although, as I noted, there are often groups that are contracted with other work. Next slide, I think skip ahead too, please. In Seattle, one of the things we found was they're disproportionately in our area in the private sector. Next slide. And not surprisingly to folks who are familiar with this industry, they're disproportionately female. Next. More likely to be Black or African American than workers in other areas. Next. and more likely to be working part-time. Next slide, please. These factors of who does the work are important for understanding why human services wages are lower than other types of work. Next slide. Our work broadly was informed by a conceptual model that looked at different structural forces, including how care work was valued. And I think these are similar to the sectoral segregation concerns that are motivating this larger webinar. Next. So we didn't try to parcel out these particular forces, but the first part of our work did try to give an overall answer to how these penalties show up in the market. This was work performed by our market analysis team, Kristen Smith from Dartmouth, Nancy Fulbray from UMass, and Layla Gautam, who was a former student of Nancy's and now working in the UK. And they used American Community Survey data from the Census Bureau to examine wage penalties net of anything we could observe about individual workers. Next slide, please. To highlight the main finding from this work, we found substantial wage penalties. So relative to workers in sectors that are unaffected or that we think are unaffected by care work penalties, human services workers are paid 30% less. We split up human services workers and other care industries. The other care sector here is education and healthcare. You note that workers in those sectors also are paid somewhat less, 11% less than workers in the rest of the economy. But there's a substantial wage gap for workers in human services. And then if you further look at workers who work in nonprofit settings relative to for-profit settings, there's an additional wage penalty. So we see a wage gap of 30 to 37% less in there. Next slide, please. The job analysis group also triangulated this work they performed a complementary analysis that looked at workers who switch out of human services work to other industries. And I'm happy to talk more about this in the Q&A, and there are full details, of course, in our report. But the underlying issue was that these were strongly similar findings. Workers earned a year later after leaving human services 7% more per hour. And because they were then less likely to be working part-time, they were earning a total of 31% more. And that really corresponds well to the 30 to 37% found in the other data. However, this work only tells us about workers who are in care work and human services work rather than in other fields. It doesn't talk about the nature of the job. And one of the things politically that was important to address was the idea that these jobs could be perhaps less demanding or require less skill. And so to examine issues like that, we turn to the second empirical part of our analysis, which was the job evaluation. Next slide, please. I often talk about this as a method of comparing apples to oranges. So again, like the method that Meg talked about, a job tool that seek to unearth soft skills, our job evaluation tool that we used, which was adapted from one used with civil service workers in the UK, looked at the broad number of factors. Next slide. Here you can see the 13 different factors that go into our job analysis skill. For instance, you see factors such as effort, physical effort, mental effort, or skills or knowledge. Overall, each one of these factors has a number of different levels with assigned points, and you end up with a range of possible job points from 300 to 1,000 for a given score. We talked to workers in the human services sector and then workers outside of the human services sector. We interviewed 22 workers altogether in our area. Next slide. And next slide. That one's too small to see. So here you can see the top scoring and the bottom scoring jobs. On the left are the human services jobs. These were all workers in human services nonprofits. And on the right are workers in our comparator jobs. And you can see the top and bottom scoring one for each category, from the teaching assistant in the nonprofit human services up to the housing director, and similar in the comparator jobs. They're really well understood if you look head to head. Next slide, please. So for instance, here is a comparison between a teaching assistant in the nonprofit sector and a project administrator who works in the public sector. The teaching assistant requires slightly more, exercises more skill, knowledge in her or his job because they have to have knowledge of child development, safety laws, the processes within their workforce. The project administrator over in the responsibility sector has more responsibility for supervision and financial resources. The teaching assistant has more responsibility for people. Overall, they have scores that are 35 or so points apart, with the human services worker being slightly higher. The median pay for a teaching assistant in our region is under $40,000 a year, and the median pay for a project manager is over $75,000. Next slide. We found similar differences in pay when comparing at the top end of the job scoring, the job evaluation as well. And from overall, we concluded from this part of our work that the skill gap between human services jobs and other jobs in the economy is not because of the differences in difficulty or skill required, but rather in spite of those. Our work concluded, next slide, with a set of 7 recommendations. And I'll just quickly highlight our short-term and long-term main recommendations here. In the short term, our highlighted recommendation was to raise real wages by a minimum of 7% as soon as possible. Next slide. In the longer run, we were interested in increasing wages substantially. I think how substantial is a political question. We didn't want to be very prescriptive on that. Next slide. However, we were willing to show policymakers the math that to close a 30% gap, because of how the math works on this, requires a 43% raise. So we're talking increases needed in the 40, 50, 60% range. Next slide. I think we would all agree that that is substantial. So far we've presented this to city and county and nonprofit philanthropic funders. The city of Seattle last week actually passed a resolution endorsing our recommendations. So we feel it's getting good local traction, and I'm happy to talk more in the Q&A. Next slide, and that's it. Thank you.
Thank you very much, Jennie, and for sticking to the time. So that we have time for discussion, I would like to go straight to James Parrott, who is the director of the Center for New York City Affairs at the New School. And just one thing to say, the job evaluation that was used by the Seattle, it was developed with unions and was gender and racial bias proofed, and is used in the UK for 1.6 million local government workers. So, but now over to James to talk about the New York City study. Thanks.
Thank you. Thanks to Ariane, Deb, and all those who organized this really important discussion. I'm very pleased to be with you this afternoon and share some research that we've been working on in recent years. Our focus here is on nonprofit sector workers providing human services under city contracts. As you can imagine, New York City government has a very expansive government. It has taken up responsibility for providing a seemingly broadening range of public services. Jennie mentioned many of those: homeless services, foster care, after-school programs for kids, senior citizens, AIDS patients, substance abuse, and growing focus in recent years on mental health needs as well. So a very extensive set of services. If I could have the next slide. So our estimates are that the city contracts out about $6 billion in human services to mainly nonprofit organizations. And this engages about 80,000, both full and part-time workers. Most of them are full-time workers providing these services. This has steadily expanded since the 1960s. These contracts have been chronically underfunded, with the result that this predominantly well-educated women of color workforce, and I'll show you the numbers on that in a minute, are paid unusually low wages, and consistently, the findings very similar to in Seattle, 20 to 30% less than similarly educated city government human service employees. And the public sector workers, of course, have far better benefits. So we're going to review the data a little bit, not dwell on that, but focus more on the policies that got us to this point and some of the possible strategies to correct these inequities. Next slide, please. Just to recap some of the factors that have led to the growth in the human services sector over time. New York City has a long tradition of settlement houses that provided a range of services for well over 100 years to immigrant and low-income communities in New York City. So as the city government took on more responsibility to provide human services, not surprisingly, it did turn to settlement houses, which had a service delivery infrastructure and were located in a decentralized fashion around the city where people who need the services live. So it was a sensible service delivery means. Of course, part of the motivation on the part of the city was to limit the further growth in municipal unions, which had really started to organize in earnest in New York City in the late 1950s and 1960s. And of course, the city pretty quickly found out that it could do this contracting out for less. And it was an effective way, in part, to decentralize the provision of services at a neighborhood level in an otherwise, very large city, where everybody's experience probably underscores the fact that large centralized bureaucracies are not very effective in really providing quality services to people where they live. These contracts typically are multi-year contracts. They're not based on the cost of providing services. The city procurement system, generally is geared to a low-cost bidder model. That's always been the case in human services, even if it doesn't make much sense to do that, because you should be interested in a quality public service that minimizes the long-term budget costs, in providing services and supports to people. And on the receiving end, there's been no shortage of willingness on the part of mission-oriented nonprofits, settlement houses, but also a range of other community groups, some single service oriented, many multi-service, multi-site operations of various sizes and reach throughout the city. Many of the larger nonprofits do have an ability to supplement government contract funds with philanthropic dollars. That's very uneven. And the scale, with $6 billion in publicly funded human services at this point, even in New York, there's a limit to how much philanthropy is willing to come in behind government and subsidize the provision of public services. While the dollar amount of the contracts has always been lower because of the lower pay for nonprofit employees, for many years, at least there were regular pay adjustments in line with municipal labor contract wage increases. So whatever the municipal unions got, in a given year, that was added to human service contracts on the personal services side anyway. Well, that practice ended in around 2007, and since then it's been a seemingly never-ending struggle just to get COLA increases. The city budget, the New York City's fiscal year ends on Friday. There may be a budget agreement today or tomorrow morning. It's very likely to include some COLA provision for human service workers. And if that's 4 to 6%, that'll certainly be welcome. But it doesn't by any means address the extent of pay inequities that we're talking about here. Really, that involves a more far-reaching structural solution than a COLA. The city has also had limited efforts over the years to provide, through different mechanisms covering different sectors, to provide health and pension benefits. The city is pretty, has backed away from those commitments. So it provides very little in the way of any fringe benefit supplements. Next slide, please. Just to give you an idea of the relative growth in the nonprofit human services sector relative to the private sector, employment in New York City has grown by 63% in core social assistance or human services since 2000, more than twice the growth in private sector employment. By core human services here, what we've done is we've set aside the very large and rapidly growing home healthcare sector and the childcare sector. Both of those are very low paying, have even greater gender pay disparity challenges, but have different funding mechanisms so that we could focus on this pretty broad range of 80,000 workers who are providing core human services. So many of these are social workers and community social service assistants, again, providing services like those that I described earlier, but leaving aside home health care and child care. Next slide. Here you can see clearly, in looking at American Community Survey data for the demographics of this workforce, 72% are women, 57% of all workers in the nonprofit human services sector are women of color. And here we compare the shares of these demographics to the private sector overall. So women of color clearly are very overrepresented in human services. White women are actually slightly underrepresented, as are both men of color and white men. Next slide. This is a sector with generally a fairly high level of education attainment, despite the very low wages that are paid. So if you look at, there 22% of human service workers have a postgraduate degree, that is usually a master's degree or better. That's slightly higher than in the private sector overall in New York City. And we have some very high-end sectors in New York City with a lot of lawyers and a lot of MBAs, a lot of doctors and so on. But this sector has a higher degree of postgraduates and a comparable extent, around 30% of workers with BAs. Next slide. Very low paid. I don't have to dwell on this. The numbers, speak for themselves. The average pay, looking at taking into account full-time and part-time workers, last year was about 38,000 in core human services. A little bit better than, the lowest paid sectors, fast food, coffee shops, home health services, grocery stores, but a lot, lower pay than we find in department stores, clothing stores, and hotels, where the degree of education attainment or skills is a far cry from what it is in human services. Next slide. The pay is so inadequate that human service workers in the city disproportionately rely on public benefits. So 22%, this looks at both full and part-time human service workers in New York City, qualify for supplemental nutrition assistance. That's quite a bit higher than the 14% share of all private sector workers, or it's twice the 11% share of public sector workers in New York City, and a similarly high disproportionate share of workers in nonprofit human services have family incomes below 200% of the federal poverty level. New York City has its own poverty measure, which takes into account, the high housing costs locally, but also factors in, various other expenses and income sources. By this measure, 2/3 of all full-time human service workers have earnings below the city's own near poverty threshold. Next slide, please.
1 minute, please, James.
All right, thanks. Here you can see the extent to which the median pay for full-time workers adjusted for education falls below in nonprofit human services than it does in the public sector overall, or in the private sector. Again, 30 to 35% on the order of what Jennie showed us about Seattle. Next slide, please. And when you drill down further to compare occupations, you see, still a 10 to 20% pay difference. Although here, even, in the comparator category, these are care workers, so their work is undervalued as well. So this is a bare minimum comparison. Next slide, please. So here we are. One slide before I start to wrap up. New York City has figured out how to pay service contract workers prevailing wages in unionized sectors where the pay levels, are much better than they are, than they generally are for less skilled workers. The median hourly pay for a full-time nonprofit worker in New York City is around $27 an hour. The city has figured out how to pay administrative assistants working under private service contracts $41 an hour, or building service workers $32 or $29 an hour, depending on the specific occupation, and so on. Next slide. So, not surprisingly, the city faces great challenges, nonprofit sector in particular, in terms of retaining and recruiting workers. There's very high turnover in this sector, and that that compromises the quality of service delivery. And as I alluded to before, lower quality public service delivery is not a smart long-term budget policy, because you want to provide human services in an effective way that helps support city residents to achieve more of their human potential sooner. And quality human service delivery is important to that. Inadequate funding, means that these workers have very poor health and retirement benefits, which discourages them from staying in the sector, and helps induce people to move to the city. These pay inequities can only be addressed through government policy. And next slide, which is my final one. So, traditional approaches to this just don't get us very far. I talked about the limits of an annual COLA approach. Minimum wage only, sets a bare minimum wage floor. Living wage doesn't do anything about wage compression or the fact that, this is a sector with a lot of, fairly well-educated workers who need to be paid higher wages. Prevailing wage doesn't really, that approach, which works well in a sector that's highly unionized, because the union contracts then become the prevailing standard. This sector is not very highly unionized. Governor Hochul had an opportunity this year to raise the minimum wage. She came up with what I thought was the worst minimum wage measure I've ever seen, and it also provided a real setback for home healthcare workers. Unionization, you would think unionization would be in the equation in New York City, given that it has a very high union density. New York State has the highest union density of any state in the country for various reasons, the subject of another webinar. That hasn't panned out in New York. There was a promising start with an historic salary pay agreement in the early childhood education sector in New York City. That's already been 4 years since then, and we need to get to the next step on that. Again, that was only starting pay. I can talk more about that if people are interested. Procurement reform to mandate full cost contracting would be a step in the right direction, but as long as you can adjust for the impact of occupational segregation, keeping care-related pay artificially low for so long. One new dimension here that might be part of this of a solution in New York City. The city formed a racial justice commission in the wake of George Floyd's murder, and there was a citywide ballot initiative that passed by a 40% margin in November of 2022 to establish the mayor's office of racial equity. The city council had established a commission on gender equity 2 years previously. So maybe we'll be able to leverage the articulated commitment on the part of many elected officials to racial and gender pay equity to get them to address the need for a semblance of pay equity in this area. Thank you.
Thank you very much. We're going to question now, and if Tessa, if you could just stop sharing. And to begin with, I would like to allow the floor briefly, or give it to two representatives from human services organizations, if you could bring them on. Lauren Wright and Tree Willard. Tree Willard is from the Seattle Human Services Coalition, although and Lauren Wright is from the Illinois Partner for Human Service. Tree, do you just briefly, kind of a minute or two, your thoughts on how you're using the research and what your hopes are for where this may go?
Happy to, thank you. Osio, Taguado, Itlaga Usti, Chi, Chickamauga, Chalagi. I am Tree Willard. I am Chickamauga Cherokee, and I'm in Seattle on Squamish and Coast Salish land. And yeah, we've been really, really grateful for all of the work that Jennie and her team did. The report has had wonderful impact. It's all stuff we've all anecdotally known for ages. Any of us who have family members who work outside of human services know we're all paid half as much as they are, right? With the same education, the same years of experience, and the same level of expertise. So I really appreciate the conversation about comparable work as opposed to equal work. Also, that came up even in our recent vote at the city council and the resolution that they just passed. And the resolution they just passed is to follow the recommendations of the UW report. That's how powerful this report has been for us. Having academia provide data has given policymakers the teeth that they need to advocate. So yeah, that's my thoughts on the report, is that we're ever grateful, and it continues to help provide a lot of momentum. Our hopes are that they follow the recommendations. So Jennie went over the recommendations. We're hoping for a 7% increase in the next year. And in order to correct a 39% deficit, you need a 37% deficit, you need a 59% increase. So the recommendation is that by 2030, we see that increase. And we're pushing into the notion that over the next 5 years, 7% this year, but 10% a year for the next 5 years after that. That's what we're pushing for here in Washington. We have to work with the city, county, and state. So that part gets complicated. It's different legislation at every level, and we need new revenue streams at every level. That's the biggest challenge that we're facing.
Thanks so much, Trey. And I think it's really gratifying for an organization like IWPR and Equal Pay Today, the collaboration between research and policy and advocacy. Lauren Wright, Lauren is from Illinois, and I think you are thinking about possibly doing a similar study now. Lauren, do you want to quickly say a couple of words?
Sure. So I'm sorry, I'm having issues with my videos, so I apologize. I will just speak very, very briefly. Illinois Partners, I'm the executive director of Illinois Partners for Human Service. We are a coalition of about 850 human service organizations across the state of Illinois. And just so appreciate and feel very reaffirmed about the data and themes that were highlighted here today. We have conducted a few research studies around human services workforce related issues in the state of Illinois, which I can link to in the chat. I won't spend too much time, but very, very similar themes were highlighted. Our research is based on feedback from our coalition, which are providers statewide. And so Media unique kind of value to that is it really shows how the systemic and structural underinvestment by the state of Illinois when it comes to lack of increases in reimbursement rates and contracts that don't cover the full costs of providing services, themes that were obviously brought up today. That has been happening in Illinois for many, many years, and that was really exacerbated by the pandemic. So I will link to a couple of our reports in the chat. We have our kind of original workforce report, which disaggregated data. Illinois did not have any disaggregated data to show who the human service workforce was, which is obviously very disappointing, but like everyone has already shared, it is disproportionately women and Black, Indigenous, and people of color. And then we did a follow-up report that was really about gauging the gap between the demand for human services and the ability or the capacity of community-based providers to actually meet that demand. And so I will link to both of those reports, and we, in partnership with many of our stakeholders, will continue this line of research and really centering the voices of frontline workforce in these conversations, because it's extremely important that they're at the forefront of this change and the investment in a really important sector. So I'll stop there.
Well, thank you very much. And so you can keep putting any questions actually into the normal chat. It's as easy to see. But I want to start with a question to really each of the speakers. I think it applies to all of us, which Kirsten Vogel has raised, which is the role of funders and employers. And firstly, she asked what hinders nonprofits from supplementing pay rates, but also the role of philanthropy. How much control do they have over wage rates? And my question also would be, how much interest and concern do they have about wage rates? And generally, I guess also the funding situation between nonprofit and city and local. So James, as Kristen asked you, directed the question to you first, I'll start with you.
Okay, so I mean, it does seem like it's clearly a clearly a government responsibility. The state and federal governments can do more. It would be great to have real leadership from the federal government in this area, as they did provide in a lot of ways in the COVID response period. But New York City's budget is sufficient enough that it should be able to address this. And I do think, as I did suggest in my presentation, the magnitude of the shortfall is so great that philanthropy is let off the hook, basically, because you're asking them to close an enormous gap. They traditionally have funded lots of direct service delivery, as well as lots of other programming in New York City. They have evolved to fund more advocacy efforts because they realize that if it has to be a budget solution, that's not going to happen just by wishing for it. You have to organize and educate people to make that happen. So they have been moving in that direction, but it really is something we've seen. Fortunately, over the past year, New York City's been faced with this tremendous influx of asylum seekers in New York City, and has managed to put together a $4.3 billion budget response over 2 years. Now, that was absolutely necessary to do. But if the city can do that, in that case, it can do that in order to stop severely underpaying human service workers who are providing those services to asylum seekers.
Jennie, do you want to go next?
Yes, happy to. One of the issues that we're seeing here in Seattle and King County, which is the county where Seattle is located, is a kind of a hot potato situation between the different levels of government and a coordination issue. The advice to nonprofits is always to diversify your funding base. And so we have many nonprofit human services organizations that do some city funded work, some county funded work, some private funded work, some state funded work. And because of issues of internal equity, they need all those funders to increase contract amounts at the same time. So although the city of Seattle has expressed some willingness to do it, no one funder wants to be out in front and paying for a wage increase for work that is not their work. But understandably, executive directors can't raise wages for two people. If you have two people doing similar jobs within an organization, one is on a city funding stream and others on a county funding stream, they can't just raise wages for one of those people. And so there's a coordination problem. The messages from executive directors are, let us figure that problem out, raise the wages. But the message that county council and city council members are voicing is they don't want to go first and not have the other parties go along with them, which may be a thing that's easier to say than no. So as you see, Tree is making signs that show some of the diffusion of responsibility there. So I think James's overall point of when priorities arise and they get met shows that there can be resources in the system is a good one.
Meg, I know that those services in Australia are mainly funded by the state, but how was the funding generated? How does revenue, is there tax increases? How do they manage that part there? And what was a good argument?
So part of the, I guess, the crisis in aged care in Australia has discussed the issue of the funding of the sector. So while there is in part funding from the federal government, it's an indirect model. so a lot of the federal government provides funding to providers to provide the care. And so in what's called sort of the financialisation of aged care and other sorts of care services. And so whether this provides an environment for A, the adequate provision of care, and B, the adequate staffing and training of workers in the sector, and then of course the remuneration for those sectors, has all been a key debate within Australia. And I guess to go to the heart of your question, Ariane, it's an interesting prospect about the tribunal's decision on the 15% wage increase. Of course, was preceded by, in the proceedings, the Australian government indicating in submissions, all parties make submissions, unions, employers, of course, the Commonwealth government indicating that it would provide funding to support the wage increase, so, but more critically, and in, points that have been raised by James and Jennie, the funding of these sectors becomes critical in a sense to their development, their evolution, their caliber, I think. And so, within Australia, of course, the issue was not only issues of vertical segregation within the sector. As Trade noted, the issue was the sector per se was undervalued compared to other sectors in a sense. And it's been the absence of funding. We've got issues in childcare as well in Australia around, it's similar sorts of issues, this indirect model of funding and whether it's sustaining. So yeah, I might leave it there, Ariane.
Yeah, thanks. So we are formally at the end of the of our time, but if I would love to ask one or two more questions, and hope some of you, as people drop off, we will drop off. But the question, another question that has come up in the chat and in our pre-discussion is the role of unions. And having worked on comparable worth issues for a long time, sometimes the male-dominated unions are very supportive, sometimes they're not, and also I know in Seattle, the unions are not very strong in that sector. So what has been the role of unions? How can we engage unions more, or are they engaged? And anybody who wants to talk on this? No one?
I'm happy to share about our engagement of unions here. We are definitely engaging the unions here, and we're told repeatedly that especially when you want to change state legislation that has anything to do with wages, the unions are essential. It's very delicate because those workers who are unionized are already in negotiations with the executive directors of many of our provider organizations. And sometimes those negotiations are contentious. So even the report, Jennie's awesome report that I was just praising, that says 7% increase immediately, that drives workers to say, we should get a 7% increase immediately. But EDs are between a rock and a hard place if they don't have more funding. Giving everybody a 7% increase immediately might mean laying 40% of their laborers off, right? So it's a very difficult place that the EDs are in as we're bringing the union in to advocate for these wage increases with legislators. They have to be in relationship with the executive directors at the same time. And that's a relationship that we're building now that's going to have to be, like, we're going to have to be in solidarity to make this happen. But it's delicate.
Ariane, I would just note here that sort of a distinction in Australia is that all workers covered by award, whether they're unionised or not, receive the wages and conditions of the award. So, workers don't have to be unionised. It's the unions who are the key advocates for changes in that award, and they they drove the minimum wage applications. So, the evidence, I was called as an expert witness by the Australian Nursing and Midwifery Federation, so was Anjuna. So awards, the receipt of wages and conditions under award is not dependent on union status. And similarly with most enterprise bargaining agreements, while they're bargained by unions, they apply to union and non-union workers alike. So,
yeah, I guess what I was getting at a little bit was
yours was a different question. Yeah.
One of our earlier webinars or presentations at the EPD convening was from the Union of Costume Designers, who are trying to get the pay raise compared to set designers, right? And you can imagine which one is female dominated and which one is male dominated. And it hasn't really been that easy to get the buy-in from the male dominated fields, kind of well organized. So it's that type of, how much we can create, how do we need to create solidarity across, and how much can we get that done?
Yep. And I think that will be a conversation in the next iteration in aged care. I think the Commission's sort of interested and has put on the table that the relativity should no longer necessarily be set with regard to the Metal Industry Award, which has sort of been a key sort of framework in Australia. And as that's unpicked and challenged, I think there will be conversations of the type that you've alluded to, Ariane, because some relativities will change, albeit that it's not some neat, discernible matrix. But the tradesperson's rate in Australian wage fixing has always proved to be something of a benchmark. Yeah.
There was a question just very quickly in the check whether where we are with comparable worth legislation in the US at federal level, nowhere. At state level, some of the recent laws say equal or equivalent pay, but there is very little case law at this stage. And I think one of the reasons for me to have this webinar is because equal pay laws rely on comparing people in the same organization. Increased care work typically is not done in the same organization as a lot of well-paid care workers, non-care workers. So I'm thinking, can we bring it into contracting, as James said, maybe or fair wage commissions or the Racial Justice Commission, or maybe there are other ways of lifting up and modernizing the concept to help us tackle underpayment of care work. So to end this, maybe last thought from each of you of whether there's something that makes you hopeful, or where you feel, in a year from now, where maybe be, or something in terms of where the strategy may or should lead us. And what you may take from something like equal pay and IWPR to help with that.
Well, I'll speak to the question about what it will take for research. I found that one of the reasons, probably the primary reason that the City Council adopted our recommendations is the years of work that the Human Services Coalition and the executive directors had put in. I think research on its own is not going to change anyone's mind on this, but good quality evidence combined with a community-led framing of the problem is the way to go on this. And I think there's a lot of energy around better pay for workers more broadly. And so this is a moment, hopefully, that we can take advantage of that.
Anybody else? James?
Ariane, I would just note sort of the benefit that arises in being able to apply a pay increase across thousands of workplaces to thousands of workers. That there's and to have a methodology that enables that to happen, to where tribunals are happy to make judgments about the value of the work that are not workplace specific, but are industry specific. And that's a very hard win to get, but you can imagine the momentum of that increase across, you know, many, many workplaces. And so a framework that enables that, you know, although not straightforward, does facilitate change.
And I guess the emphasis on infrastructure and good jobs and unions is one of our leading lights at the moment. James?
I would just add, so, you know, I hadn't thought of myself as optimistic on this front necessarily if you had asked me this morning, but having heard the Seattle report and the city council action, that gives me hope. But I also, you know, need to remind myself that we have a human services sector that has really demonstrated a capacity to organize and mobilize itself. They turned out 6,000 people in City Hall Park a few weeks ago to press for, you know, a real cost of living agreement this year. Last year, we thought they did great when they turned out 1,000 people, and that was unheard of. So it's 6,000 people this year. You get the idea of the trend there. You know, one of the missing ingredients so far is that we have a union at District Council 37 of AFSCME, which has recently taken over. They've recently inherited the long dormant jurisdiction for organizing nonprofit workers in New York City, and they've been struggling to try and figure out how to do that. I think there's no substitute for tapping in to the organizing ability of that the Human Services Council has shown in New York City. And if you get the workforce organized, we have an African-American mayor of the city. We have an African-American woman who's speaker of the city council. We have a lot of women of color in the city council, chairing key committees and so on. So hopefully all of these factors will come together in the next year or two.
And Ariane, I just want to wrap up. I also just want to say that, look, as a civil rights attorney, I have to be optimistic because that's our job, and to keep fighting the good fight and look at the long game. And I remember working on equal pay and comparable worth issues before anybody, you know, before it had pierced the public consciousness in the way that it has over the last 15 years or so. So I remain optimistic. I will say that the Equal Pay Today policy agenda that's just been endorsed by over 40 national, state, and local organizations that's going up to Congress looks at one of the pillars contributing to unequal pay as occupational segregation, the relegation of work to low paid and undervalued work. And organizations are mobilizing around that. There is legislation in Congress called the Fair Pay Act, which looks at equal pay for similar work. Unfortunately, it gets introduced year after year in the House by Eleanor Holmes Norton, but doesn't have support in the Senate. And we know where things are in Congress, but people are organizing and endorsing and looking at occupational segregation in a new way from its in the 80s and 90s in the beginning of this fight, when it wasn't as popular or mainstream a topic. So it may be slow, but we're making progress, and people should be optimistic, but continue to mobilize.
Well, and we all work together. Equal Pay Today and IWPR will try to push forward this movement. So thank you very much, everybody, for the contributions. We really appreciate it, and everybody who's in the audience and stayed on for taking part. And we will circulate the recording and the references and the slides, and we will watch this space for future presentations on this or similar issues. So thank you very much, and have a wonderful day, evening, afternoon,
morning.
Bye.
Thanks, everyone.